Good evening, Trinidad and Tobago. Good evening, Caribbean. Good evening, world. This is another presentation of the Tobago CivilNet. Today, it's the first of the series, Conversations with the Candidates. Just a bit about Tobago CivilNet. Tobago CivilNet is a non-partisan group of Tobago civil society organizations and concerned citizens who are combining forces for the purpose of having a collective input in Tobago's development. This body includes representation from education, agriculture and the environment, youth development, arts and culture, tourism, and the business sector. Today with us, we have Ms. Nikosi Philip, political leader of Unity of the People, Dr. Denise Sarfat-Angus, the political leader of the Innovative Democratic Alliance, and joining us at 6:30 will be Dr. Faith B. Israel of the Progressive Democratic Patriots. And our topic this evening is something that has been bothering us for the last year and a half, since March 2020, and that is the COVID-19 pandemic. And we will be discussing, so while it's political leaders and people in political parties, this is not a political debate. It's a civil discourse on how we are handling the pandemic. So we have a doctor in our midst, Dr. Denise Sarfat-Angus is a medical doctor. We'll start with her. And Dr. Denise, are you satisfied with the COVID management thus far? And is there anything else you would do or would have done differently if you were the person in authority?
Well, let me first of all say good evening to everyone, and thank you to Tobago CivilNet for hosting this forum on the specific topic on health. I am not satisfied with how the pandemic is being handled. Initially, the government appeared to have done well in terms of the handling of it, but in every pandemic, you have to transition into different phases, and they have not transitioned well. I also feel that a more aggressive education and awareness program should have been started early on to allay persons' fears. This is not the first time that we have had pandemics. This is not the first time we have had, this type of infectious diseases. We had the H1N1, we had SARS, and they all follow a specific pattern. People are in fear. They're in fear for their lives, for their bodies, and they're also in fear for what may be coming into their bodies. And you have to realize and identify that. And therefore, you go to them in their spaces. So I would have gone to them in the community centers, in communities, meeting them where they are, and then you educate them. The second thing is, everyone knows that in a crisis like this, the nurses are the most trusted healthcare workers. Then come the doctors. And therefore, and the politicians, definitely you want them to speak much less. Yes, they give policy, but at the same time, you want to get the medical people in there, especially your nurses. So I would have taken a panel of nurses and doctors into the communities for them to continue educating the people, but not just educating them about the need to take a vaccine, but educating them about behavioral changes. Because even though we have been vaccinated or not vaccinated, both sides can still get the virus and spread it to others. So therefore, it has to be about behavior modification more than anything else. And whether they want to take the vaccine or not, you educate them, but you have to do the behavioral modification with them. And those are some of the things that I would have ensured. Additionally, this pandemic has not only devastated lives and health, but devastated the economy, devastated the way our children, the opportunity to learn in the environment to which they had become accustomed. And I believe one of the areas that they really fell short on is the fact that we have children who are going to school and they depended on a meal when they got to school. You've now sent children home to be isolated, um, and you've sent them home, and uh, there's no guarantee that these children are even getting a meal, because whereas parents may not have had enough to really supply them and depended on the school feeding, some of those parents have even less now because they lost their jobs. And I feel that it was very short-sighted of the government not to continue the school feeding program to students in their homes. They could have had caterers in the communities of where the children live. And I mean, the children are registered, so you know where they live, but at least they would have been guaranteed a meal wherever they are. And in guaranteeing them a meal, you cannot imagine how that, just the act of making sure those children could eat, would have stimulated and kept the economy going. Because in order to have them eat, you had to prepare the foods, you had to engage a driver to drop off those foods, you had to get the grocery stores going. There were so many persons who could have benefited just from that one policy of feeding the children. And so the policies have really not focused on family and people, but just out of fear of the pandemic. I don't know how much more I have more, but I don't know if you want me to continue or you want to give.
We'll come at it, but thank you for that very comprehensive response. And can I ask Ms. Philip to weigh in on the same question? Are you satisfied with the COVID-19 management thus far? And is there anything else you have done? Were you in charge?
I would give them a 30-70%, and 70 weighing in that I am disappointed in some of the policies used or how the policies were used. In regards to I second everything that Dr. Angus said. Maybe I should have gone first, so therefore I would have get all the headway. But in regards to the grants, to this date, I have a list of 2,473 persons from Trinidad who have contacted me. In Tobago, 547 persons that have not received any social assistance from since 2020. I have text messages, I have calls. I even started posting the text messages responses from social development to our Facebook page to see the same song that they've been singing. They have not received any finances from the Minister of Finance, so they cannot issue 2020. In regards to the grant, we had the grants issue in 2020. We were looking to see that there would have been an update in all the negative things that would have happened on persons issuing grant, but yet we've been getting them going to Parliament and only talking about, oh, we find corruption and persons second the pin. Yes, but nobody has been arrested, and all that was just excuses for the failure of their management in that regards. In regards to the people, I second with Dr. Angus in regards to these children. I made mention on many press conferences in regards to the community centers. We have school in every community in Tobago. Children have to leave from Better to come to Buku because they're going to Buku school, but they have to leave from Better to come to Buku to get lunches. Why not they use the community? Every community center has a community. Every community has a community center. Use the community centers or use the schools in each community to distribute the lunches, and children from within the community can go to their own community or to get the lunches. And that is an issue that was there. We started off, our NGO and myself would have started off distributing lunch to some of the children till that school initiative started from the government. Also, we would have also done for the elderly in regards to elderly lunches and distributions of things for that purpose. Moving on to the management of information. I believe that we have so many misinformation. 1 minute you hear the Minister of Health saying Face masks wouldn't save you. It doesn't make sense. Then they hear him say, yes, it works now. Then they put in implementation to force people and charging people for not wearing masks at a large sum. We also have the information where they asked if HIV drugs were used, like tetracycline and cyclovir were used to make the vaccines. No. And then you're hearing yes. You're hearing information about, since November last year, they were talking about airborne. They dispel it, the Minister of Health dispel it, and all we need to do is start to look back at these video recordings. He dispelled it and said there's nothing with airborne, but yet the CDC in America would have said yes, it was airborne. Now, in March of this year, or March or April, he now then said the virus is airborne. So education in regards to information and the accurate information from the ministry, that is also a failure. In regards to the forcing of the vaccination on the people itself or the citizens.
Ms. Phillip, can I just ask if you could turn the background noise down a little bit? I think it's coming through.
Oh.
Maybe the speaker, you could turn it down a bit.
Speaker. Okay.
Or the volume. There's some background noise coming through.
Okay, let me just check it.
Right, sure. So sorry to disturb your trend. Oh, I think your microphone is off now. You need to, no. You muted.
I think, yes, I think that was the Baker passing with the.
Oh, okay, all right.
Yes.
Okay, cool. All right. So
Maybe
continue.
on my control. Sorry about that.
Yeah, sure.
Right.
Okay.
Yeah, in regards to a patient, as in the pharmacy field also, I've worked in the hospital, I'm in the pharmacy as well, and a pharmacy technician. We always know in all teachings, they taught us that patient has 10 chart of rights. Now there's 18 chart of rights. One of them is the right to access treatment, the right to information, the right to refuse medication, and a long list. And forcing vaccination on persons without having them, take it. Yes, we know we're in a pandemic. Yes, we know people are getting sick. But at the end of the day, give people the choice to make that. And you know what happened to this government? This government, to me, and any other government that comes, they know that, let me just say Black people or people on a whole, do not read or do not take the time to learn the laws that governs them. So anything that they force and they say that has to be done will be done because they know the people cannot write. Patients have all rights. People have rights to refuse medication or to refuse treatment. Yes, we're in a pandemic and we need to move forward, but at the end of the day, as I said before, you come now and force mandatory vaccination on the children, and parents were not consulted. Tutor didn't get consulted until they see information coming out. And I believe if you would have given pamphlets with the different types of vaccination that you have to the parents or to the parents in each community and let them decide or have consultation with them, then parents would say, well, based on the information given, I can now say, well, my child could take it. But there's a lack of education in regards to the vaccines. I have reached out to the political leader or the Secretary of Health on many private occasions to ask, where are the pamphlets? Can you organize some pamphlets? Because, we could do as much as we can. But if we don't get the source information from the persons who have received the vaccines and would have the information, we can't give out pamphlets just so without information from the Ministry of Health. And up to this day, there's no pamphlet, there's no response to that. We're only going to say we look into it. So I believe more could have been done. And at the end of the day, they did what they could have done, but the ego of some of them is just a failure for some of us citizens.
Okay, thanks very much. So both you and Dr. Angus are talking about more effective public communication. So to those of us who are now tuning in, today we're talking with two of the candidates in the upcoming THA elections. Joining us in the next 15 minutes will be Dr. Faith B. as well. And just a reminder that the Tobago CivilNet is a non-partisan group of Tobago civil society organizations and concerned citizens, all combining forces for the purpose of having collective input on Tobago's development. Also, just to let you know that all the political parties were invited, but as you have noticed, 3 accepted, 1 did not accept. So they were all invited. So, Ms. Phillips, I will have you give you first shot on this one because you said you work in the health sector, and whenever COVID-19 deaths are announced, we are hearing about comorbidities. And the question here is, what are your thoughts on preventative medical care in Tobago?
One of the things that we would have worked on, Miss Alison Bushadon, my senior pharmacist as well. One of the things we started in the health centers, especially in Canaan, was the diabetic prevention and education unit, where we would have looked at persons who were diabetic or had those medical diseases such as those comorbidities. We would have had monthly education training programs for them, how to take a medication, how to prevent diabetes, the type of foods to eat. We also would have done a number of research to see how many persons in the communities of Canaan, Buku, Mount Pleasant, the different communities, especially when we have pharmacy week, would have given the technicians time to talk about the medication, how to use the medication. Then we would have given the pharmacist time to speak on the use of the medication, the prevention of getting diabetes, or looking out for the methods. There are so many things that are happening in regards to comorbidities. All of a sudden, every death is now comorbidities. So that begs the question, the whole of Trinidad and Tobago or persons within the country has comorbidities. Because if we didn't see a problem then, and I think that they should have had a database from that database and other database in regards to information of persons within the country who has comorbidities such as asthma, diabetes, or any form of illness that would cause them to depart with this pandemic should have been listed. But to me, persons who have no illness, have no sickness before, all of a sudden died of COVID-19, and then they hear them saying the person had a comorbidity that they didn't know about. That I said, the accuracy, the truth behind some of these things is questionable. And I believe that as a healthcare system, there is so many things that we need to put in place. At the United Nations, the former health secretary, before Ms. Tracy Davidson, Mr. Carrington, would have mentioned a number of programs in regards to the health and safety and well-being of citizens, in regards to the school children getting the types of meals that would be good for them, in regards to the lack of oily foods and stuff. And all these programs were set and implemented or were issued on the United Nations. What we have in our country is that when there's a predecessor or somebody takes over, they dismantle the programs that are in place. And I believe that if we have the proper continuum of education in regards to our health and well-being, we have the proper foods, and you see, we could have the proper foods, but you can't carry the cow by the river and force it to drink water because people will eat what they want. You have KFC in America. I also know that in America, in KFC, there is something, they give you a card. If you have cholesterol, the card will identify to you. You come and you show them the card, they will know that your cholesterol, they give you a different type of meat in KFC. I've seen that in Baltimore. If you have diabetes, they will treat you the different foods when you come into KFC and some of the other food places. Those are things that we should bring here and adapt that. Let KFC do education in regards to their oils, the kind of fatty foods that they're giving to people, and in regards to that. You can't give people a free meal if you have diabetes. That does not make sense. So I believe that the healthcare sector needs to improve in regards to proper proposals and policies of our health and well-being, and the management of continuing these programs. So therefore now we could lessen the comorbidities, also the medication being used. The types of medication sometimes may cause more harm than good. And I believe that we should also have an uphaul of the types of medication we use for these diabetes and stuff, and have proper treatments for some of these things. Go back to the remedies of bush medicine. Go back to the remedies, because for me, long time when you have a cold, the first thing you do is to go to the beach, or there's this kind of bush on the beach that you use to boil. And when you drink that, you have all the cold and all the thing coming up. Go back to the long time bush medicine. Sometimes it works. And I believe that the comorbidities that are coming out, I don't believe some of them. That's just my opinion.
Okay, thanks very much, Ms. Phillips. And can I ask Dr. Stafford Angus to weigh in on this? What are your thoughts on preventative medical care in Tobago, Dr. Angus?
Preventative medical care in Tobago has run a roller coaster journey. Roller coaster because depending on what level of leadership you have, emphasis is placed on different areas throughout the sector, and sometimes it's placed on primary care, and sometimes it is not placed on the primary care sector. And we all must appreciate by now that our comorbidities are usually our lifestyle diseases, your diabetes, your high blood pressure, your cholesterol issues, um, and your asthma, you know, and many times these are related to lifestyle. And so over the last year and a half, we have seen a crash in the primary care system because because of the management of the pandemic and the fears. Literally, things came to a grinding halt where our primary care support systems fell down. And, we have to recognize that even though we are in a pandemic, people have other illnesses that they have suffered for years. And so we have to make sure that they were able to be maintained. And so throughout the years, you have, like I said, if we had been consistent in the past, then with the pandemic, it would not have been that challenge to build upon the system that is there and to have the results you have now. The mere fact that the majority of cases that are coming out speaks to the fact that you have so many comorbidities. It says that, our system is probably not doing as well as it should. So that is really the evidence that you're looking at there facing you. When we talk about the pandemic, and I want to go back to the pandemic in a way, the reason why we are not getting persons who want to perhaps, like you say, comply with whatever the government is suggesting is this people don't trust what the government is telling them. When you have a lack of transparency and consistency in your protocols, it becomes hard to convince people that you're doing good for them. And when I talk about the lack of transparency and consistency in the protocols, I refer to the fact that sometimes you hear a person gets quarantined for 3 days, 7 days, 10 days, 14 days, 21 days. There are a lot of inconsistencies there. And it seems, it appears to be that depending on what level you are in the society, your protocol changes from 14 to 7 to 3, and persons are not foolish. They look at that and they interpret that. And I think that is one of the largest problems we have with the trust in the system. The other area is that the information is not being released in a way that lends to the credibility of the system. I know many doctors felt that they were not getting the information in terms of the numbers and the statistics coming out of the Ministry of Health. If the doctors feel as if they are not being involved and they have access to the information, how can they assist in helping their patients to better understand? They can't. And that is an area that they really, that is a bit of a challenge in terms of the access to information. The other day, someone sent out, oh, we have 10 patients diagnosed with Delta. So I sent back a message. I said, how many of those have died? How do you use that information to help the cause of lifting awareness? Just telling us 10 people were found with Delta doesn't really, say anything to us. How many of those people died? How many of those people, had severe symptoms or whatever? there should have been a, something else that speaks to it rather than just a number coming out. And, you get the feeling that now it's just a numbers game and it's no longer a people game, no longer caring about the people, but it's more about the numbers. So, again, can we really trust when they say everyone has died with comorbidities? Or is the health sector, in a way, just covering themselves in terms of, feeling that they haven't managed the situation properly? But nobody, I mean, people die. It's not the first flu that will kill some people. So, we feel that, there has to be more, like I said, accountability in terms of the numbers. And I think sometimes people are not even believing that all those numbers are coming with comorbidities.
Thank you very much, Dr. Soya. So you're saying there needs to be more analysis of the information available and consistency of implementation of public policy. So I want to break at this stage to welcome to the panel Dr. Faith B. as well. Good evening, Dr. B. as well, and welcome. And I go turn immediately to you and ask for your thoughts on preventative medical care in Tobago.
What is that? I mean, let's be honest. Have we really been doing any kind of preventative medical care at all in Tobago? We've been very reactive for everything, which means that we wait until the person gets sick. Probably more than just waiting until the person gets sick. We wait until the person gets very sick. And that is because of the way the system is set up. If you have to wait for a year for a diagnostic tool to become available, within that year, you could have gone from not being well to being you could have gone from being okay to not being well to being detrimentally ill, just waiting for the diagnostic tool to be available for you to determine whether you are sick or not. So I don't know that we've done a whole lot at really preventing illnesses generally in Tobago. And I don't know that we've done a whole lot at even really preventing COVID-19 in Tobago, particularly since when you look at the fact that Tobago has some of the higher rates of non-communicable diseases, the diabetes. Every single one of us knows of somebody with diabetes if we're not talking about ourselves. We know somebody with heart disease if we're not talking about ourselves. We know somebody with, all of these non-communicable diseases. The fact that we knew very earlier that non-communicable diseases, if you had a non-communicable disease, it meant that you were at higher risk of getting a severe illness or possibly even dying from COVID. It means that we should have actually spent a whole lot more time ensuring that our preventative mechanisms for COVID were in place, but also ensuring that we were able to identify those with COVID early, quickly, so that we could treat them. We could do secondary prevention, which is, you've just found out somebody's sick. So you treat them as early as possible to ensure that they don't get even more sick. And I think this is where we have failed miserably on the island. We don't do preventative stuff generally, and certainly as it relates to COVID, knowing that we have such high rates of non-communicable diseases, we certainly did not put things in place to ensure that we did not have the high rates of deaths that we are experiencing linked to COVID. And I am using the word linked to COVID because I think there are significant questions about whether what we are reporting is death from COVID or death with COVID. And that is a serious issue that we also need to take into consideration at this point.
Dr. Faith, and some will argue that non-communicable diseases are the responsibility of the individual and not necessarily the system. And that leads me directly to a question from the audience. And the question is this: what do panelists think would be the most effective way to improve the diet of Tobagonians? And 1 minute. Considering that we generally eat so unhealthily, what are your views on that?
Well, I think I could jump in here. If we were really just to blame individuals for everything, then there was really no point in having a primary healthcare system. We should all just wait and just allow people to go to the hospital because all we're treating. Primary healthcare is a big chunk of primary healthcare is to help us to prevent and to help us to not get too sick if we do get sick. There's also a part of preventative mechanisms that is known as primordial prevention. What is primordial prevention? This is when we have organizations, this is when we have entities like the government, for example, putting mechanisms in place to help protect our citizens even before they have come into contact with the thing that is going to make them sick. So, for example, when we have a policy that says we are not going to allow smoking inside of buildings, that's an example of primordial prevention, because you are not just saying to the person not to smoke, or to the person sitting there, move from the person who's smoking. You've removed that entire environment. And those are some of the things we need to start thinking about. When we have policies in schools, for example, that relates to what we feed our children. My mother, for example, was a preschool teacher. She just retired. And one of the things they implemented in their school is that they stopped giving snack breaks. They started calling them fruit breaks, because there was an expectation that the only thing the children would eat at that time would be a healthy local fruit. Again, that's an example of a primordial method of preventing, of helping people make some of these decisions. Yes, we are saying that people are responsible for what they ultimately do, but some of the responsibilities of government is to also help people make those healthier decisions.
Thank you very much, Dr. B, as well. And we go back to Dr. Denise Angus. The same question, Dr. Angus. So, what in your view are some of the most effective ways to improve the diet of Tobagonians because of how badly they eat?
I think one of the first ways you can begin to impact that is by the policies that we have, and that list, that VAT-free list. If we encouraged a VAT-free, healthy list, it would then allow people that they could actually afford to buy healthy food. Yet what we got was a list of foods that absolutely, if you go to the nutritionist, they will tell you, you can't eat any of those things. So we can begin by having that type of policy that helps people to afford healthy food, because we all know healthy food is not cheap. What tends to be cheap is the most unhealthy food that we could find. And that is one of the most significant policies that the administration can do, any government can do, in helping people to afford healthy food. Changing people's approach and lifestyle begins even when a mother is pregnant. And so educating a mother when she's pregnant, because everyone knows first-time pregnancies, they want to do everything perfect for that baby. And for me, that is an opportune time to get in and begin educating that parent. Even if they didn't do it themselves, you begin telling them about the future of their child and how best to provide for their child. That must be backed up in our school system, where you also do screening in schools and you educate the children. Children are not too young to learn about what is good to eat and what is not so good. And oftentimes they go home and teach the parents. So we have to get into that education system. We also have to put, I remember when I was the chairman of the Signal Hill Comprehensive High School, it was one of the first policies that came about in any high school or school across Tobago, where we said the no soda in schools policy. Sodas carry a high amount of sugar. And if we can decide to take out the sodas out of schools, that in itself would be something significantly impacting. And I must commend Faith's mother, Mrs. Brebner, for that, fruit break. That is very, it's a good initiative. And that is perhaps something that should be applied across schools. I really, it is really sometimes very disheartening to see how the policies have not favored lifestyle changes. The mere fact that our children are not really encouraged to get out there and exercise much. So I think the government can do more in terms of their overarching policies to assist this. And it is not just the responsibility of the person, because the person may not even be able to afford to eat any differently to improve their health.
Okay, thanks, Dr. Sheppard and Ms. Phillips on the eating of Tobagonians. And we have enough questions to last 3 hours. We have an hour and a half, so it does need to be a little crisper. Ms. Phillips, over to you, please, on how Tobagonians eat.
We also have to look, we can put as much policies we want in place, but we also have to look at our culture in Trinidad and Tobago. We have Easter, where's all the meat, all the pork, everything you could eat. We have Carnival, we have Christmas, we have all these activities that people must cook. So even in the school, I remember in the days they used to teach us the charts of how to eat. I think they should enhance that chart, continue doing that. Physical education in the schools, especially primary school, they would have the school gardens. And those are things that they could work on. But as I said, we're in a society where everything is alive and everything is a cook. So it is going to be difficult for persons. I believe it's an individual choice and an individual responsibility for adults to know what they eat and know how they eat. We'll look at parents now to see how they will grow their child. But then again, as Dr. Angus says, is if that person or if that parent could afford the things that could treat with the child eating healthy. Because if that is a single parent and you have 4 kids and you can't afford some of these things, it's going to be difficult. So I believe that a lot has to be done. It's a responsibility on you as an individual to eat healthy and to eat the right things. There's a responsibility on the government to put policies in place and to see how best you can enforce the policies. But then again, you say even at the schools you ban soda. Then the soda is not the only thing. They have cheese pie. They have these oily foods. They have other things. And then if you ban, even though you ban soda in schools, you still have somebody outside canteens who are selling soda. So you're just filling a top in mud. So it's something that a public education is needed in regards to the health and well-being of our young people, our single parents and adults. And that is how I think we should move forward. Because as I said, you can't carry the cow by the river and force it to drink water.
Thank you very much. And let us hope that their collective responses resonate across Tobago. Now, the Chief Medical Officer for the last almost year has been, let's say, complaining about the low level of vaccination rate in Tobago, and he speaks about the higher than normal COVID infection and higher than normal death rate in Tobago from COVID. And the Secretary for Health also laments on the low vaccination rate and highlighted the vaccination, the death rate and infection rate. Why do you think, Ms. Phillips, that the vaccination rate in Tobago is so low? And is there a difference between East Tobago and West Tobago?
I believe, as we said in the beginning, public education. Persons are not stupid. For example, I think there was a death where somebody fell off a ladder. And then 9 days after, the family came out and said 9 days after, they come now and say she died of COVID. And then they tested a dead body to get to see if they had COVID. So I think people are not stupid. People need the right information. And with the right information, they even have questions. I'm now here on my phone and somebody now texts me to ask me how many THA secretaries or leaders or ministers have taken the vaccine and have their families take the vaccine. That's what the person now texts me to ask. And that is what they're looking on at. Because if you have in parliament persons who are vaccinated, they could come in, and who are not vaccinated, they can rotate. And they're looking at us leaders who take the vaccine and who don't take it. People are looking on. People are getting afraid because they're hearing, remember, this virus is not a God-made virus, you know. This is a man-made virus that was created. And they're asking the question, why aren't we finding the persons and sanctioning them for treason? Because this is a treason against humanity. What are our world leaders doing to find the persons who created such a virus that almost wipe out the population? So I think it's a drive. Just recently we had a vaccination drive in Buku, is the only the day when I actually walk out the house is when I saw the vaccination. I was like, what all the things are? Oh, we have a vaccination drive in Boko, education, information. We have politicians going around with speakers informing them of to vote, but you should have done the same thing as a Secretary of Health to have these speakers through the community and say, well, listen, we're coming in Boko this week to do vaccination. Get vaccinated. We are not getting that. We're only seeing things happening, and then they expect us to just fall in line with what is happening. And as I said, for me, I have my reserves personally about the vaccination process. There's information that I'm still waiting on to make a decision, but I will not stop persons from getting or tell them not to get vaccinated or force them to get vaccinated. It's a choice based on the information that they have, based on the knowledge of the vaccination, and based on their doctor's approval to get vaccinated. And that's as much as I can say in regards to that.
Thanks, Mr. Phillips and Dr. Angus. Why do you think the vaccination rate in Tobago is so low?
And lack of information and lack of access to information. And you're quite correct, the rates of unvaccinated are higher in the East than in the West. And I go back to the point, when there is a lack of transparency and consistency in the protocols, in what people say from time to time, in the policies that they create, okay, then people do not trust. And when people don't trust, they're not going to allow you to do things with their bodies. When they don't trust what you're saying, they don't trust that you even did the same thing with your body. And so I feel that there must have been very early on a concerted effort to gain the trust of the people. Instead, they lost the trust of the people very early with a number of incidents that would have occurred where they decided that initially they said the politicians would take the vaccine first so they could have, they could lead. That didn't happen. They had another set of people take the vaccines first, the healthcare workers. And then later on, you saw some of the politicians take the vaccine, I believe, when the Sinopharm came. So again, there was a lot of misinformation in the public domain. Additionally, we are assuming that every time a live happens on TV, that persons have a TV, have access to a TV, or even have access to data to listen to what is going on with the live. And then what happens is that you have the telegram system where persons are getting the information 3 and 4 times from person to person to person. And of course, we know that information changes until it is totally different. They needed to go to people in communities and have the healthcare workers share the information with the people in communities, give testimonies, allay persons' fears. And when you bring them into the community centers, it's an opportunity to teach them how to behave, washing their hands and what distance they're supposed to be sitting apart, keeping their mask on, all these other approaches that are critical. Because I want to say to persons, even though you are vaccinated or unvaccinated, both groups can get the virus, can transmit the virus. The difference is that those who are vaccinated may have less severe symptoms. But at the end of the day, you can still, transmit. And therefore, when you have policies where, people are going about going to the grocery, doing everything they want to do, and then you suddenly say, well, only vaccinated children can go to school, the unvaccinated stay home, and then within 3 days of that decision, all of a sudden, everybody could go to school together. So if you're saying that you should be separated and you have safe zones, how come all of a sudden it's okay for the children to go together to the same school? You see, it's decisions like those and policies like those that have people going, and have you wondering what really is the policy going forward. Yet you have open air environment. We all know that it is best to be in open air. The best open air we have is the sea. That is the absolute last that you have to open. The absolute last. I mean, that totally floors me. You're prepared to open a water park, but not the natural salt water, the seawater, where persons have access, where it is free for them to go out and enjoy. And access to the beach is not just about pleasure. There are many persons who go to the beach for therapy. So you're denying them of what they consider to be their medical therapy. Many stroke patients go to exercise themselves, and they have been cut off. So again, I believe that the policies that have been laid out over time has created a sense of mistrust, a growing sense of mistrust, and also the lack of access to information, because again, we assume that people even have a TV. I know people had to sell their TVs to eat, so they have no access anymore. Things are really bad out there, and I don't believe that the current administration has a grasp on how serious the issue is, the economic impact on this issue on families.
Thank you, Dr. Ann. That's very thought-provoking. And over to you, Dr. B, as well. Your thoughts on the low vaccination rate in Tobago, and is there a difference between East and West Tobago?
Sure. So I actually, coming from a public health perspective as a health educator, one of the things I recognized very early is that we were not getting accurate information. We were getting a lot of information, but a lot of it is not accurate information. Some of the information we were getting was accurate, yes, but because those who were getting it are not familiar with the systems that are normally in place, they were not able to put it into context. And information without the right context creates what we have now. And let me give an example. There was a friend of mine who sent an article to me. This was months and months ago. It was when we were up in arms about AstraZeneca doing the issue with blood clots and that kind of thing. And the article said, I think very early, the headline was 50 people took AstraZeneca, got blood clots and so forth. And it was like, whoa, that's just ridiculous. That's crazy. Giving the impression that, there was really a problem. When I read the article, I went all the way down, and it took me maybe 10 minutes to get to the point. In the article that said, these were 50 people out of maybe 30 million who had taken the AstraZeneca. So yes, 50 people is a lot if you are one of those 50 or a family member of those 50. But 50 out of 30 million puts it into a completely different perspective. Again, it goes back to understanding the information and understanding what it means and understanding how we do things in the medical world. Again, I would like to, something else that is perpetuated. Yes, individuals who have been vaccinated can get COVID-19 and can transmit COVID-19. But if you stop the sentence there, again, that is accurate, but it is not in full context. The reality is the viral load of somebody who has COVID-19, who was vaccinated, is much lower than the viral load of somebody after a certain number of days of somebody who was not vaccinated, which means even though that person can contract it and can give it to somebody else, the probability of that person giving it to somebody else is significantly lower than it will for somebody who was not vaccinated. When you look at the death rates of individuals who got COVID and who died, so yes, there are people who get COVID, who got vaccinated and got COVID. But again, look at it in context. When you look at the number of people who actually died, looking at those who were vaccinated versus those who were not vaccinated, there is a huge disparity. A friend of mine actually messaged me about a week and a half ago, and he said, and he was very, very real in his thoughts. He said he's afraid. He wants to get the vaccine, but he is afraid that he is going to die. Now I asked him, why are you afraid that you are going to die? He said, because the information that is out there that he's getting, what is bombarding him, is that the vaccine is killing people. So I said to him, we have about 20 or so thousand people in Tobago who've been vaccinated. Do you know any of those people that they've gotten an adverse event? Do you know any of those people who died? Um, and of course, the answer was no, I don't personally. He was hearing all of the stories that kept making the cycle, the stories that kept making the cycle. And then I said to him, but do you personally know anyone who got COVID and who has died from COVID? And he could have named several. Because the reality is, even though his fear was of dying from the vaccine, having the conversation with him, we were able to get to the point where if death is really the fear, we know so many more people, unfortunately, who have died as a result of COVID. We don't know people who died as a result of the vaccine. Again, going back to, we have a lot of information that is being peddled, but a lot of it is inaccurate. Go back to a situation where we all saw the video of this gentleman who said that he had gotten the vaccine and that he put a light bulb on his arm and the light bulb lit up. I got that video. When I saw that video, I thought, ha ha ha, this is just so silly, no one is going to believe this. Until somebody actually met me and asked me genuinely about whether that was going to happen to them. And that is where I thought, wow, something that I giggled about because I understand, the virus. I understand how vaccines work. I understand how our bodies work. I just giggled at it. But I was able to giggle at it because I have a whole doctoral degree. I have a whole bachelor's degree in neuroscience, where this was a big chunk of what we were studying. So I was able to very quickly decipher truth from lie. A big chunk of our population is not able to decipher truth from lie. And I think going back to how we dealt with health education in the beginning, as a matter of fact, I don't think we've ever really done health education as it relates to COVID from a larger policy, Ministry of Health, or even Division of Health perspective. We never actually said, what is the information that people need? What are the genuine questions that they have? And then let us find ways to give them the answers to those genuine questions. Instead, what we got were these horrible press conferences. And by the way, I have stopped listening to these press conferences. It is my job to listen to them, and I have stopped. Because I am sick and tired of the health people there, or even the politicians there, cussing me, buffing me, in essence, talking to me as if I, just do it, instead of providing me with the necessary information. Which is why I have taken it upon myself to spend a significant amount of my private time, my personal time, actually going into the communities. I've been at countless PTA meetings and so forth, chatting with the parents and the teachers and so forth, answering their questions about the virus, answering their questions about the vaccines, and allaying their fears, because many of them have fears. And let me give one perfect example. We only found out about this virus, 2020, the name of the virus itself, SARS-CoV-2, the name of the disease, COVID-19, because it came around in 2019. Shortly after, we have a vaccine. And anybody who is right thinking would think, okay, so this happened really quickly. How is it that this happened really quickly? And what I have to remind people is that when you look at this virus, it's actually a second version, for very layman too, of the SARS virus that we were dealing with in 2003. Now, in Trinidad and Tobago, we probably did not have scientists studying SARS from 2003, trying to figure out how to treat it, trying to figure out how to get a vaccine against it, because it wasn't a problem for Trinidad and Tobago. But there were professionals all over the world who were actually studying these things. And then we had the benefit of having good, improved technology. The same we have improved technology for the TVs that we have and the cars that we have and so forth. We have improved technologies to identify the genetic makeup of this SARS-CoV-2. Putting those two things together means that we actually are living in a blessed time where we did not have to wait for months and months and years and years and years to get the information to create a vaccine. But this didn't just start last year or the year before. This information, we were pulling this information from since 2003 when people were studying SARS back then. This is the kind of information we need to give to individuals so that they are very clear that this isn't just some no-come thing that nobody has studied or anything like that. That is simply not true. And the longer we take to listen to people's genuine concerns, find the answers and provide a way for us to get the answers to them, the longer we would be in this pandemic. We need to stop, we need to think, we need to listen, and we need to actually give people the answers to the questions that they have. By the way, the individual who said that they were afraid to die, they actually went ahead and got the vaccine because we had the conversation and because we were able to allay his fears. That is what we need to do. And until we do that, we're going to keep being in this position.
Thank you, Dr. B, as well. And this is highly educational panelists. And while Tobago CivilNet may have conceptualize this in the context of the upcoming elections, I think they need to do something like this, separate and apart and outside of elections, because I am sure Tobagonians are listening and their minds are slowly changing and their understanding. Unfortunately, we only have 33 minutes left, and I will go straight to earlier the discussion was about livelihood. So we were talking about saving lives, but we locked down the economy for the last year and a half. It's starting to reopen, and people, as Dr. Sheppard said, people have to sell their televisions to survive. So the question here is, has the reopening process been adequate in managing the immense negative social, economic, and health fallout from the pandemic? What needs to be changed? So I'll go to Ms. Phillips. Ms. Phillips, your comments and thoughts on the reopening process of the economy and the extent to which it's adequate in managing the negative fallouts, the social, economic, and health fallout of the pandemic. Over to you.
I believe that policy is a failure. The reopen measures in regards to vaccinated and unvaccinated safe zone, that's a failure as well. You're opening back and you're putting implementation of taxes that people have a deadline to pay who have not been working for the past year or two. That's a failure. Persons still waiting for grants from since 2020 to know.
Let me just distribute 1 minute, please. If you could just make it 2 minutes, because we have a lot to cover. I think people are really, really interested, and questions are coming in. So all panelists, 2 minutes per question. Thanks.
Right. And I believe that a lot could be done and a lot should have been done, but you have to make sure that persons have sustainable development in regards to people. And there's ways of persons can use these social programs and social initiatives that will benefit them in regards to funding to reopening back the economy, because it doesn't make sense it makes sense reopening the economy, but how you do it, how you put which sectors are more important than the other sectors. So I believe that a lot should have been done.
Thanks much. And Dr. Anders, your thoughts on reopening the economy, how is it being managed so far?
Again, I don't think the government looks at the holistic view of a policy when they make that policy. Take, for instance, they said all workers going back to work. Workers are going back to work. Workers are going back to work, but daycare centers are still closed. Teachers are going back to school. Daycare centers are still closed. So what you had happening is that you had an underground system that developed just to be able to persons to manage to get back to work to put food on their tables. So that thought process, when you they're not thinking about families, they're just thinking, okay, make people go back to work, not understanding what it takes for a family to get back to work when you have small children at home. I mean, when you're looking at the fact that as part of, let's talk about the treatment of the COVID. Someone goes in, they get diagnosed with COVID, and you decide to send them home. You send them home with nothing. Could you have sent them home with a care package? Could you have sent them home with, Tylenol, vitamin C, something? The placebo effect is real. And sometimes people, once they feel like they've gotten something, they feel like if they could get better. And so send them home with something, because what would happen is that people are leaving the hospital, they're diagnosed with COVID, they're told to go home, they're taking the taxi goes to the pharmacy to stop. If they could afford to get medication, they go there, they're COVID positive, they go to the pharmacy, and then they say, oops, I'm going to be on quarantine. Let me pass and pick up some things because I don't have any groceries at their house. And they then go home. So you've just created an additional spread. But what about those who are going home who have nothing? They have nothing at their house. And they go home to a family of 5, and persons, one room, one bathroom, and that they're struggling because they can't afford to take off. So they're hiding to go to work and still going to work. And again, I feel more could have been done. Once they're leaving, you make sure they get home safely. You have the social worker check in, evaluate their situation, provide them with whatever their needs are right away. I feel that we could have had a more predictable way in taking care of people during this pandemic in terms of how we were treating with them, and even the hamper situation that has been just, so ad hoc, and persons who really need it, it still is yet to get to them. It still is yet to get to them. And of course, endorse that issue with all the grants that are still outstanding for people. It has totally, you could say it has crashed the economy. I don't know how we're going to get out of this.
Yeah, thanks, Dr. Anders and Dr. Bezer.
Sure. So I think we have to get out of this by thinking about this period as a moment to re-engineer how our economy functions. Going back to what happened during COVID, and I would kind of bring this to the Tobago space. We heard in Trinidad how many millions and millions and upwards of billions of dollars that was spent on COVID. When you hear us speak about the COVID-related spend in Tobago, you hear about the 50 million that was sent to health, you hear about the 50 million that was sent to tourism, and another 10 million that was for something else I can't remember. When what we should have done on the island was to ensure that we took care of the 60,000 of us on the island. Now, if that meant, and it was one of the questions that came up all the time, the government of Trinidad and Tobago went into the Heritage and Stabilization Fund to fund the COVID response. That included COVID relief, COVID response, the medical aspect of it as well. When we were asking the Minister of Health how much of that was coming to Tobago, the Minister of Health then said that the Secretary of Finance and the Tobago House of Assembly was responsible for requesting those additional funds from the Heritage and Stabilization Fund. The fact that he had to say that meant that we did not do that, which means we did not do all that we could have done in Tobago to ensure that the 60,000 of us on the island were able to just survive for that period. And we also did not take the time to say, well, okay, this is an opportunity for us to stop. This is an opportunity for us to halt. Maybe we needed that time to think and to reimagine and to re-engineer the economy of Tobago. That is where I'm hoping we would be able to go in the near future. So we are not just stopping the economy, Ram, and then starting back the economy, hoping that the economy that was failing even before COVID will be able to pick up just like that. No, we have to actively re-engineer what the economy of Tobago would look like, and then put specific policies and specific resources in place to ensure that that actually becomes a reality. Just stopping the economy and starting back the economy is not going to do that. Pure failure.
Okay, thanks very much. So just one more question on COVID and then some questions on the upcoming election. So these are two questions, they're related. I'll read them quickly and just maybe half a minute, please. First question is, are our doctors and health professionals fully equipped and knowledgeable to deal with this pandemic, or do they simply rely on the dictates of WHO? And the other question is, do our local scientists and experts approve mass vaccinations based on research done nationally, or are we strictly piggybacking on information pushed by the social media and WHO? They related. That's a quick thought on a quick response. The Dr. B as well.
Sure.
Sure.
Okay, so the reality is that in Trinidad and Tobago, we don't do a lot of hard science. So we don't have a choice but to rely on the science that's coming out of the WHO and coming out of all of those other organizations. I think that was a shock to most people, that we do not do hard science in Trinidad and Tobago. We don't have the facilities to do it. We don't have the universities that do it. We don't do any of that. So it would be unrealistic to expect us to suddenly do it for COVID when we were not doing it for anything else. I think as it relates to the doctors and nurses and health professionals, what we have here is a system that has failed them. Not only has it failed us, but the system has failed them by not providing all of the resources. I get the calls, I get the messages from them who are saying they are overworked, they do not have the diagnostic tools available, they don't have the technical capacity, as in the tools that are needed to do what they need to do. So they are strapped, and then we turn around and blame them after the fact, and I think that is quite unfair. This is a systemic problem that I think we need to fix on a larger level and not just try to focus on what the health professionals are doing, because they really are doing as much as they can with what they have.
Okay, thanks so much, Dr. Case and Dr. Angus. Your thoughts on this, please.
Absolutely, I totally agree with what Dr. Bernard has said in terms of our lack of the capacity and the ability to do any research in this country here, and therefore rely on whatever is handed down from elsewhere. And for me, even though you look at the standards, you must be able to say to yourself that we live in a different environment, and you have to be able to adapt and work those standards into our culture, into the environment in which we live, and not just adopt it carte blanche. The system also, I agree, has failed our health care workers. The mere fact that we have had no access to the lab situation. That whole lab situation is ridiculous. You can't tell me that to this day, the public health sector could not have had a lab on this island to treat with COVID and the early diagnosis, and therefore the earlier tracing of individuals exposed to COVID. Yet we could have a private lab who brings it from Trinidad and stationed here. What has happened to the public sector being able to do that? Tobago has responsibility under the 5th schedule for health. And I would say that they gave up that responsibility by not even having lab facilities here. Additionally, there should have been a total audit of all health professionals who are on the island, and therefore who can give assistance and relief to those healthcare workers. I was called from Trinidad and asked whether I would come to Trinidad and volunteer my time down there as a medical doctor. They just called me. I said, well, I live in Tobago. If you want me to come down, sure. But for me, it was, I am right here in Tobago. Tobago is struggling. They have not called, but Trinidad found my name under the medical doctor's license program, and they called me to find whether I could come down there and give, assistance. And I think that in Tobago, they have totally misread the whole thing. There's a total lack of understanding of how the medical part of this should have been treated, and the resources that were needed to ensure that we were in a good place. And I don't understand. We had H1N1 and ran a good program here. I worked alongside Dr. Faith on that program. We did quite well. There are books and procedures and manuals available. Why aren't they following it? So, really, they did not do well in that regard. So.
Thanks, Dr. Angus. And Ms. Phillips, your thoughts on the question, the scientists and whether they're following WHO blindly?
Well, the both on my side, Dr. Angus and Dr. Faith has answered everything well done. All I would just like to add is that I just want to clarify something. Dr. Faith, you said that we don't have scientists here, or just correct me if I'm wrong. We don't have scientists here, or we don't have the capacity to do scientific data and analysis and all these things here. Right? That's correct, right? Something to that sort.
Yes, the technical capacity that is needed inside of the labs, for example, we do not, let me give an example. The reason why we only know how many people, a few people have Delta is because those samples need to go to UA because UA actually has the technical capacity to do that kind of testing, but that's only that one thing at UA. We don't have it all over, and we certainly don't have it in Tobago.
Right, so let me just put this into the educate your minds. Remember on the interview that when any of us like leaders speak on the vaccination and the accuracy and all these things, the Prime Minister and the Minister of Health would shut us down and say that they rely on the scientists that they have and the scientific data and tests and all the things that our scientists of Trinidad and Tobago are doing. That's all I'm going to say. I'm going to leave it right there.
Okay, thanks very much. And apparently there's a huge audience listening, and Tobago CivilNet has asked that I announce that there's another event on November the 4th at 8 p.m. Same Zoom town hall part 2 of this discussion with civil society. So people keep your, put it in your calendar, the 4th of November at 8 p.m. This discussion continues with another moderator, maybe other panelists, but this discussion has to continue. So Dr. Angus, the question earlier to you was whether the IDA will be contesting all 15 seats in the upcoming elections.
IDA has been working towards giving people the best representation that we could in as many seats as we could. So we have not fully decided yet completely. We should be able to know by this week.
Okay, thanks very much. And a related question on the elections, given the pandemic, do you all anticipate a low turnout on the elections on December 6th? And how do you suggest getting people to the polls in a pandemic? So start with Ms. Phillips. Do you expect a low turnout? And the other part of it, how do you expect people to get to the polls, or suggest that political parties get people to the polls in this pandemic? And we know how it's transmitted.
Well, once we don't have this stupid ideology of vaccinated persons could vote only and unvaccinated can. Once we don't have that, I think we should have a very good turnout, because the people of Tobago now have woken up and they have seen that we actually need the leadership. You've seen that we had the two leaderships that couldn't come together, one ego bigger than the other, that they didn't want to work together. So I think that we will have a very high turnout. I am expecting that in order for us as political leaders and politicians to go forward, we have to make sure that all safety measures are in place by the EBC, and we just have to educate the people and to tell them, well, listen, you just come to vote, you don't talk, you don't lie, you just do the same thing as you did before in January, and that's about it, you go. I think that the turnout will be overwhelming this time, and this is the time for the people to speak. And this is not the time for you to be silent or use social media to say you're not voting or you're voting. Come out and vote and do what you're supposed to do, hands down.
Thanks, Ms. Phillips and Dr. Angus.
I believe there will be a high voter turnout. I think people have been waiting to exhale. They've been waiting to exhale for a while now, and it was as if their breath was caught halfway in January. And therefore, they want to get this over with, and they want to give a clear mandate to the administration going forward. And I believe that persons are going to turn out, despite the fact that they are being threatened in terms of vaccinated or unvaccinated. Persons are going to come out because they recognize that if they go to the grocery and protect themselves, they are fine. You don't know who is vaccinated or unvaccinated when you go to the grocery, but you have to go to the grocery. And likewise, persons are going to go to the polls when the polls are opened, and they will vote. And we have to ensure that we put protocols in place at our respective areas and advise our drivers or runners, those people, in terms of how they operate within this space. I think it is important that persons come out and exercise their right. What concerns me is the stance taken by the police when they said they will lock up people, you know, persons who are coming out to listen. I mean, how can you suppress persons' democratic rights to hear what is going on and to express their views? And I really am very upset by that statement that was made, and I hope that that does not scare people to come out. It is most likely going to be in an open air area. And if you can pack persons into THA buildings and other buildings to work side by side, then of course I believe persons can come out and social distance within the open ventilated air and come out and hear what the plans and policies are of persons on the platforms. It is important that we allow freedom of democracy to reign. Because I mean, how could you put out a statement like that? That, to me, is very unfortunate. And I don't know where that was instigated from, but you know, it is unfortunate. And perhaps that is why the state of emergency has been maintained for so long, in an attempt to suppress the people access to information. But let me say, the information will get out and the
Thank you,
people will come out and vote.
Thank you, Dr. Anderson. Dr. B as well on the voter turnout.
So, election day is probably the only day in Tobago, in Trinidad and Tobago, where every single person over the age of 18 is equal to the other person. It doesn't matter who you are, it doesn't matter your educational status, it doesn't matter how rich you are, it doesn't matter whether you're vaccinated or not. Election day is the one day where we are all equals because we all have one vote. I think what happened in January allowed people to realize that, hey, the direction that we've been going thus far, it ain't working, it ain't working, it ain't now gonna work. And this is an opportunity for them to come out and be very decisive. When you look at the data, the districts where people did not come out and vote, meaning that there will be the turnouts of 40% or less than 55%, those were the areas where the incumbent retained their leadership. The areas where people came out and vote, those were the areas where we had a change. That says something to people. It also means that you need to be very careful when you have individuals trying to convince you to not go out and vote. You have to ask yourself, what is their rationale? What are they trying to do? What are they trying to suppress? As long as people come out and vote, we will have the necessary change that is required to move Tobago out of where we are now into a whole new light. And I think that people have woken up and people are going to take the opportunity on December 6th to show what they want for Tobago. I firmly believe that.
Thank you, Dr. B as well. And just a house announcement to all those now tuning in. Today we are talking to the candidates of the THA election, December 2021. Gently reminder that the Tobago CivilNet is a non-partisan group of Tobago civil society organizations and concerned citizens, all combining forces for the purpose of having collective input on Tobago's development. And Tobago CivilNet had invited all the political parties taking part in these elections, but as you can see, 3 parties responded positively, 1 did not. That's why we have 3 representatives here this evening. So we move on to another issue that has been very topical, and I think it was 2 days ago, the Member of Parliament for Caroni East, I believe it was, made a link or connection between the safe zone concept and what is perceived to be a spike in COVID-19 cases. And the question is, what do you think, what are your thoughts on the safe zone concept, the health implications, economic implications, social implications? Continue with you, Dr. Bezrel, the safe zone concept.
Well, the safe zones will work, but only if a large enough volume of the population is vaccinated. Again, going back to, I agree with Dr. Angus about the mixed messages. You cannot talk about having a safe zone and then right after have a conversation about people who are not vaccinated also being allowed in the safe zone. Because again, that is confusing the whole situation. I am not aware. I would actually like to see the data to see whether there is really any correlation between the higher rates and the safe zones, because I also know that there's a huge difference between causation and correlation, and what may be happening may be really a correlation with Delta, higher cases of Delta versus the safe zone, and the safe zone just being a confounding variable at this point. So I would actually like to look at the data a little more closely to determine whether that statement is actually true. But my stance has been that we do know the areas of the world, the countries of the world that are going back to normal, that are lifting restrictions, are the countries that have very high vaccination rates. And those are the countries that also have very low infection rates and low death rates. The science does show that the vaccines are actually working. And I would encourage people to be vaccinated, get your questions answered. Yes, all of that. But I am encouraging people to get vaccinated. But the safe zones will not work if we maintain the levels of vaccination that we have now. And we will quickly go back to what happened with the schools, for example, where we are going to realize we're not going to be able to maintain that policy because the number of children who were vaccinated was just too low for it to make sense. We need to work on all of those things in tandem to ensure that the things that work are actually in place for the things to work.
Dr. Kate and Ms. Phillips, your thoughts on the safe zones? Or your microphone is muted, so just unmute.
Yes, I haven't yet seen the report. I've heard of the report, but I haven't seen it because I was out of the social media for a while. In regards to that, while I was in Trinidad last 2 weeks, I did visit a number of safe zones. And I was actually able to go in the safe zones. I went into a bar and buy a phone card. I went into a next bar and buy a drink. I went into a gym, walk in the gym and ask for a tour just to see how it is and to see how they're doing. I was able to walk into a number of safe zones. So this safe zone initiative, if you're not being policed, it will not work. Because I went into a number of places in Trinidad and I was just free. I'm not vaccinated. I'm not even fully vaccinated, nothing. And I was able to walk in. I spoke and said, can I go use the toilet? Can I just see how the gym is, how people responding to it? I went into some bars. So, safe zone or not, I don't think it makes sense. It makes sense if you're trying to make money off of the business owners. And it's kind of good for some of the business because the business people and the business heads are the ones who wanted safe zones. So if I have a business and I have one person who's vaccinated and 99 persons who's not vaccinated, but I have to make money to run my business, what do you expect me to do? Forget about the 99 and take the one? I don't think that will happen. Just saying, as a leader, a responsible leader, maybe I wouldn't do that, but that is what is actually in public and that is what is actually happening.
Thanks so much, Dr. Angus. Your thoughts on the safe zones?
Well, I hope that they wouldn't call the names because those people will be slapped with a $25,000 fine. Money they didn't even make off of the one drink that you bought. I really think that the safe zones are leading us down the road of a further economic crisis. And everything you look at is the cost versus benefit ratio. And when you look at the cost to business owners to follow the safe zone procedures versus the benefit, it is really prohibitive. So I could understand why persons are now taking chances just to allow anyone in. The unfortunate thing is that some persons get away with it and other persons are being put under serious pressure for it. And I'm saying that we need to take another look at this safe zones issue. Because when you think about it, you're supposed to be examining some type of vaccination card. Has the government released an official, authentic vaccination card that they are saying this is the card no matter what? And therefore, if you as a business person accept that and it is not that way, how are they taking you to court to charge you for all of this when they have not put out something authentic in terms of the guideline? And that's why I keep saying this government, they do not think through their policies to the end. They are being very reactive all the time, and it is not helping the situation. The economy is crashing. It has crashed, and the safe zones is not helping the economy. There are many persons who just threw up their hands and said, I might as well close because I cannot handle wing half capacity. And then apart from that, you're telling me I have to hire another person to check a card to see if a person is vaccinated or not, and then have to determine whether the card is authentic or not and take a risk. So it is not helping. I think they need to take another look at it. I again state that in Tobago, where we depend on our beaches for our tourism product, we depend on our beaches, we are being punished in Tobago. There are many other areas that are opening up in Trinidad, markets, all kinds of stuff, and our beaches are closed. We are being punished. It has to stop.
Right, so panelists, we have 3 minutes to wrap up, and wrap up with just this question. Given what we've learned for the last year and a half, what do you think we have to do to prepare for the next pandemic? Just your closing thoughts on that. Maybe 45 seconds each, please. Dr. Angus, go ahead.
They need to go back and do a real debriefing to understand what has taken place, accept and agree on what they did wrong and try not to hide it, because the only way you prepare for a new pandemic, you have to be honest about what went well. You have to be brutally honest about what did not go well and what should have been done better. And that is the only way that you can really prepare for another pandemic that is coming. It is clear that the pandemic protocols that they would normally follow, there's actually a whole manual, that they never followed it. They never followed it. Okay. And so they need to review everything. They need to upgrade that protocol manual, and they need to agree to follow it the next time around.
So thanks, Dr. Angus and Ms. Phillips. And then we go to Dr. B as well. Ms. Phillips, your thoughts, closing thoughts on preparation. Closing thoughts on how we prepare for another pandemic, because Dr. Fauci said another one will come. What do we need to do? Given what we know, what do we need to do to prepare for the next pandemic?
Well, first thing first, we will have to hijack Mr. Fauci here, because apparently they know when all these pandemics coming. So we'll have to hijack him and squeeze all the information so we can get to prepare. And what we need to do is to look at the mechanism that have failed in regards to the social health for the people, in regards to the business sector, in regards to the management of our systems, and how can we recover. The usage of the road to recovery team that has failed both in Tobago and Trinidad, because if you have a road to recovery team, I'm not hearing anything about them. There's one in Trinidad would have given a package and they're not using the package. So that was a waste of people just sitting on there doing nothing or giving positions. We have to look at the borrowing and the spending of monies and how the monies are disseminated, especially being Tobago being an island on its own and having a Tobago House of Assembly that needs to have the funding that will, not just what you give us, but it will have to spread across the border. For example, you have the U.S. Embassy given.
Okay, Ms. Phillips, I need to get Dr. Faith's closing words. So you have 5 seconds. Thanks. Okay. Dr. Faith?
Yes, sure. We have to stop behaving as if the first time we are seeing this is the first time anybody in the whole wide world is seeing this. There are manuals, there are mechanisms, there are protocols that have worked, and that we simply needed to tweak to ensure that it fit into our culture. We need to go back to that. As Dr. Angus said, we did H1N1 a couple of years ago, and all of that is just sitting there. We could have actually used it because it would have worked for this kind of situation. So we need to stop behaving like we are reinventing the wheel, go to the best practices and simply use them. Accept that what we did not work, what we did for COVID did not work, and make a concerted effort to do it differently next time. And the different has actually already been outlined by several other countries, several other places where we can learn from their mistakes.
Thank you very much, panelists. And on behalf of Tobago Civil Net, thank you for taking the time out and sharing your experience. I think we are only now warming up. We're just getting started. And I think the audience will have learned so much this evening that this has to continue. And do have a good evening and do have a safe evening and continue to be safe around Tobago. We need to get over this. Time is up, so thank you very much. We do appreciate your presence here. Have a good evening.
Thank you all. Thank you, panel.
Welcome. Sure.
Bye.
Okay.